Before surgery, I had to focus on my knee. The last 2 years I've been on crutches. Parking lot scared me because I didn't want to have to walk very far. I took 8 Advil a day to control the pain. I was very depressed. It prevented me from enjoying life, enjoying my friends, enjoying my family. I was miserable. I mean, it was awful. I feel like I lost 2 years of my life. And then I decided to look at surgeons. Howard Community has their own wing for orthopedic patients. So that's how I met Dr. Wong.
So as far as Cassandra's story, she came to me after struggling for many, many years with severe knee pain. She had tried everything previously as far as non-surgical treatment. Nothing had really significantly helped her over the years. When we first met, I talked to her about the operation and the surgery and the technology that we had available, and she was very excited for that. And thankfully, she's done absolutely phenomenally afterwards.
A couple hours after you wake up from surgery, they walk you down the hall, and I was so amazed that I could walk normal. The pain was gone. And I walked farther that, 3 hours after surgery than I'd ever walked in years.
And I think that's a true testament to the capabilities and the power of robotic knee replacement is in that early, faster recovery and just making an even already very good operation even better and more reliable.
Dr. Wong explained to me that the robot, it can see things that he can't, and it can make more precise cuts, which in the long run would help with pain management. So I was really excited about that. Now, I don't even think twice about my knee. I can do swimming, I can walk, I can exercise, I can teach with confidence. My family has me back. I got my life back.